Hey, welcome back everybody. So in this lesson we're going to be continuing with anatomy chapter 1. So in last lesson we went over the anatomical terminologies. In this lesson we're going to be continuing to follow the book, which is Clinical Orientated Anatomy, and we're going to start by going through a brief introduction to each of the systems. And the first system that we're going to be talking about is the integumentary system. I think that's how it's pronounced. I never really knew how to pronounce that properly, but we're going to be going over the integumentary system. So the things that we're going to be doing in this video, hopefully I'll try and make it as short as possible, but still make it detailed enough for you to get a solid idea of what this system is. Firstly, we're going to be going over what exactly is the integumentary system, and then we're going to be looking at the different parts of the system and what their functions are, etc. And then after that we're going to do some clinical correlates that are also mentioned in the book. I'm going to explain that and try and give you a good idea of how that relates to the information that we're going to be studying today. And then after that we're going to do some review questions of what we studied today. So hopefully by the end of the video you have a very strong grasp of the integumentary system, and then you can move on positively to the next video. So let's get started. Okay, so what exactly is the integumentary system? So in the body you have lots of different systems. You have the cardiovascular system, the respiratory system, you have the endocrine system, the central nervous system. These are all different organ systems that carry out their own particular functions, and if you put all of the systems of the body together, that's when you get a fully functioning, healthy human being. So one of the other systems that are in the body is the integumentary system, and it comprises of the skin and the appendages that comes with the skin. So if you think of the cardiovascular system, you're thinking mainly of, pumping blood around the body. If you think about the neurological system, then you're thinking, it's to control the body, it's to control your mind, your thoughts, etc. If you think about the respiratory system, it's all about breathing in oxygen and removing CO2 from the body. If you think about the endocrine system, you're thinking mainly about enzyme function and controlling your blood sugar levels and hormones and all of those kind of things. And if you think about the integumentary system, you should be thinking about the skin and the functions that the skin has. So before we get started about what the function of the skin is really, let's define this word here, appendages, because not everyone knows exactly what this means. Essentially, appendages mean the supporting structure of the thing that you're talking about. So in the skin, what it really means is things like your sweat glands, your hair follicles, your nails, the subcutaneous tissue that's underneath the skin. So essentially that's what it is. So let me ask you this question. Okay, so just to recap quickly, so the integumentary system is made up of the skin and the appendages. So here, if you look down on your skin now, in your arm right now, you can see your skin, and then your skin is essentially made up of this. You have this top layer here, you have another layer underneath it, and you have a layer there. So this is what exists below your skin right now, and this, if you take all of the skin of your body, this is known as your integumentary system. So let me ask you this question. What is the largest organ of the body? Take a guess. So in fact, you might be surprised. The largest organ in the body is actually your skin. And you might be really surprised to hear that. I definitely was surprised to hear that when I first studied it. To be honest, I've got to admit, I said it was the liver, and some people probably said the lungs, but the skin is actually the largest organ of the body. And you might be thinking, okay, how is the skin the largest organ of the body? How is it even an organ? Essentially, anything with a blood supply is known as an organ. Anything that has different parts in it and it has a blood supply, as you can see here, look, there's blood entering the skin, that's an organ. So the skin is made up of two parts. It's made up of your epidermis and it's made up of your dermis, okay, as it's written here, right? And the word epi essentially means above, okay, so it makes sense that the epidermis comes first and then the dermis comes second. As you can see here, this bit here is your epidermis, okay, and then this is your dermis, okay, right here, okay. And so this is what makes up the two layers of your skin. So now let's look at them individually, or let's look at the function of the skin. But what we're going to do is we're going to look at the epidermis and the dermis individually. We're going to see what it really comprises of and what's its function. Okay, so what is the function of the skin? Okay, so remember, we're talking about the integumentary system and essentially what it is. And we said that the skin plays a big part in the integumentary system. So really the function of the skin is the function of the integumentary system. So let's look at its functions. So number one, protection. Okay, so how does the skin protect yourself? Why don't you pause the video and try and figure it out for yourself. So the skin, obviously, it acts as a barrier from the outside world, from the outside environment to your body. It protects it from things like microorganisms. It protects it from maybe mechanical damage to it. So, and it has other ways to actually protect it. For example, within your here in your hair follicles here, you have these sebaceous glands, okay, and what they do, they secrete some oily material and then it goes up onto the skin, and that oily material is actually quite acidic, and so what it does is that it kills off bacteria that might be on the skin. So that's one of the ways that it might protect it. As you can see here, it's almost like a big barrier between the outside and the inside, okay, so that's another way it can protect you from the outside world. Another function is thermal regulation. So it can help to manage your body temperature, and so the way that it does that is that it has, number one, it has blood vessels. Number two, it has sweat glands. Okay, and so all of these, they work together to kind of manage, in a way, your body temperature. So if you're really hot, then what happens is that your blood vessels will actually dilate. Okay, so it will bring a lot more blood to your skin surface, and that in turn, what it does is that it releases the heat that's inside the blood out of the body. Okay, also sweat glands, when you sweat, essentially what you're doing is that you're wetting the surface of your body. So when that meets, when the blood that's coming from your dilated blood vessels meets the wet surface, it releases the heat from your body. And your hair, it functions by basically trapping. So if this is your hair here, okay, and this is the surface of your skin, what it does is that it kind of traps air it traps air in between it, so it creates a kind of cool air conditioning of the skin surface, and that kind of cools the body down. So you can see like so what happens is sometimes when you're cold, your hair your hair will stand up, and that kind of traps air, and it regulates your body temperature. It can bring your temperature. It can trap warm air in between your hair follicles, or your hair. Sorry, so essentially your hair, it stands up, it becomes erect, and it traps air in between the hair on your skin, and it creates a warm layer, not a cool layer, a warm layer. And then when you're hot, they go down. Okay, so that's enough of that. And the third function is that it contains the body. So it keeps the body in place, right? So it kind of like holds the body tightly together. Of course, there's other things that are holding the body tightly together, but that's one of the skin's functions as well. The fourth is your sensation. So in your skin, and there's another diagram later, I might as well just show you now. Okay, in your skin, basically you have nerve fibers, like this. You have nerve fibers, and what they do is that they help you with your touch sensation and your pain sensation and your thermal sensation. So all of these kind of sensory stimuli, they can sense, they help you basically with your touch and your thermal sensation and all these kind of things. And your fifth function will be storage and synthesis of vitamin D. So this one, you should just be aware of it. You'll cover this more in physiology, but essentially vitamin D is really, really important for your calcium levels in your body. And of course, calcium is really important for things like your bones and other structures in your body. So what happens is that you need to create vitamin D in your body, and the process of creating vitamin D, it starts in your skin because it stores a precursor to vitamin D, like the starting molecule, or we can call it the immature vitamin D. It's stored in your skin, and it basically gets stimulated by sunlight, and then it goes to your liver and it goes to your kidney to actually get made into a mature vitamin D. So without your skin, there would be no vitamin D. So your skin is very important for the storage and synthesis of vitamin D. I reckon if you know this, you could impress your professor or your teacher or your other classmates with this piece of information here. And then finally, beauty. Imagine yourself without skin. You walk around looking like a muscular skeletal specimen of yourself. You look absolutely terrible. So beauty is another big function of your skin. It kind of smoothens the body out and it makes you look attractive. Right. Okay, so those were the functions of your skin. And remember, now we said that your skin is made up of two layers, essentially. Your epidermis and your dermis. Okay, so both of these are made up of different things, and they also have their different functions. So it's important for us to understand them. And just a reminder, just so we can take a step back for a minute, remember that the reason why we're talking about all of this is because we're trying to understand what the integumentary system is, right? Because it's a system in the body that it adds to all of those other systems that makes the complete human being, remember? So we said that there's a cardiovascular system, a respiratory system, there's a neurological system. Well, when you add the respiratory, the lungs, the respiratory, the cardiovascular, the neurological, the endocrine, the digestive system, and the integumentary system together, you're creating a human being. And each of these systems have their own functions and their own structures inside them that we need to understand. And so what we're doing now is that we're breaking the integumentary system down, and we're understanding its own structures and its own functions so that we can get a good idea of why this system is important in our body. So far we said that the main thing in the integumentary system is the skin and what's inside the skin and what's the functions of the skin. So we said that the skin's main functions are these, okay? And the two things that really make up what the skin is the epidermis and the dermis, as we can see from this diagram here. So now what we're doing is that we're going to look at the epidermis, the top layer of the skin, and we're going to see what it's made up of, and then what its function is. So the epidermis, okay, as we said before, it's above the dermis. Epi means up or above, so above the dermis. It's basically keratinized epithelium. So it's made up of keratinized epithelium. So what does that mean? So essentially, keratinized epithelium is like a tough, waterproof layer. So when you hear the word epithelium, you'll probably go over this in more detail in histology, but epithelium, basically your body is made up of cells, right? And then all of the organs in your body, they're made up of cells, right? But they have an outer layer and an inner layer. So normally the outer layers of any organ, okay, and in this case the skin, are known as epithelium, right? And so the epidermis is made up of epithelium, which is essentially cells, okay? And this type of epithelium, these type of cells, they're essentially keratinized. It basically means that they're a tough, waterproof like layer. Basically, they're dried out cells, and it creates this almost like silky smooth finish to the skin on the top surface, and that helps with a lot of the skin's functions like protection and being waterproof, etc. We're not like sponges. If you put water, if you go for a shower, you're not going to absorb all of the water like a sponge. You're going to be able to wipe that water off, and that's essentially what this keratinization of the epithelium does. Okay, so let me just maybe explain that a little bit more. So let's say that this here is your epithelium. So underneath here, this is your dermis, right? Okay, so this is your epidermis, and then here this is your dermis, like we saw in this diagram here. Okay, so the way that the epidermis is made, okay, is that at the bottom you have these basal cells, okay, and they're like stem cells. They continuously reproduce. So the aim of the epidermis is that you want to, on the top layer here, you want to create a load of keratinized epithelium. In other words, you want to create keratinized cells, which are those waterproof, drained out, dry cells, okay? Because that's what creates that smooth finish to the skin. So what happens is that the basal cells at the bottom, they're able to replicate and create lots of cells. And so you have more cells here, okay? And these cells are still quite fresh cells, they're alive, okay? But what happens is that as they rise to the top, they slowly lose all of their content and they become dry. And that's one of the functions of skin. It's a normal thing, that it's not a disease or anything, but that's the whole purpose. So the basal cells, they're going to continuously reproduce, and they're going to continuously replicate and create lots and lots of different epithelial cells, and all of these cells are going to go up, and as they rise, they're going to become drier and they're going to become more dead. And as they reach the top, they're not necessarily dead, but they're keratinized. So they become very what's a good word to explain it? Very tough and smooth, and all of the content has kind of come out, and that's the meaning of keratinized. Okay, so I just wanted to explain that in a little bit more detail so that you could maybe make sense of it a little bit more, but that's enough for now. So the second thing to know about the epidermis is that there's no blood vessels inside it. Okay, there's only blood vessels in the dermis. So you might be asking, okay, so how do these cells survive? Because it's the blood vessels that carry the oxygen and they carry the nutrients. So how are these cells here being nourished? And the way that they're nourished is essentially they get their oxygen and nutrients from this blood supply here. So it diffuses, it kind of rises by itself, and it supplies these cells here. Okay, there's no blood vessels that are running through the epidermis. Okay, there's no blood vessels that supply the epidermis. And that's sometimes why if you cut yourself by accident and it's not too deep, that's why you don't necessarily bleed, because you've not cut into one of these blood vessels here. Okay, so there's also no lymphatics. So again, the lymphatic system, it runs at the bottom in the dermis as well. Remember, the lymphatic system's got to do with your immune system, and it's got to do with kind of draining any excess fluid that's in the tissue and removing it, so there's not a lot of swelling. Okay, so the epidermis, it doesn't have a lot of nerves in it, but it does have a few. So it has a few nerves, and essentially, often these nerves, they've got to do with your what we call your crude sensation. So that's the feeling of dullness on your skin, not the feeling of sharp objects, but the feeling of dullness. So if you take, for example, the round end of your pen and you kind of stroke it on your skin, those nerves in your epidermis, they are sensing that round dull sensation. Or if you press your hand on your arm, for example, that dull sensation that you get from your hand pressing on your skin, that's sensed by the nerves in your epidermis, whereas there's nerves in your dermis that sense the sharper objects, or they sense vibration. That's a lot of physiology, but I just want to kind of make it a little bit more interesting so you're not just memorizing words. Okay, but the point to take home is that your epidermis, it doesn't really have anything inside it other than a few nerves and some cells that are slowly becoming drier. Okay, it's essentially just a waterproof, tough covering for the body. There's It does have other functions in it, of course, which again you're going to study in different subjects. But for now, all you really need to know is that your epithelium, it's a tough waterproof cover for your body, okay? And it doesn't have any blood vessels, it doesn't have any lymphatic vessels, and it has only a few nerve fibers in it. So let's look at the second layer, the dermis, right? So what's the take-home point for the dermis? Essentially, the dermis is a dense layer of collagen. If there's anything you want to take away from this slide here, is this. It's a dense layer of collagen. We said that the epidermis was lots of cells that are kind of becoming drier, and they're creating a waterproof, tough covering for the body. Well, your dermis is essentially just a layer of collagen, okay? And the thing that you should understand about the dermis is that it contains a lot of collagen, as we said. So what exactly, what is collagen? You're probably thinking, okay, I've heard of collagen, like Botox and all of that stuff, but what really is collagen? Essentially, collagen is there to connect things together, and it makes things elastic and flexible. Okay, so like for example, if you want to, if you're a surgeon, okay, and you're operating on a person who is young and healthy and not dead, essentially, when you make an incision, okay, if you make a small incision, if you take your scalpel, okay, the knife that surgeons use, and you make a small incision into the skin, that skin can actually be expanded a lot, okay? You can stretch that out, you can stretch that hole out a lot, and you can put lots of instruments inside, and you can open that incision up, and you can look at what's inside. And the reason for that is because the skin has, or the dermis has, lots of collagen inside it, which makes it very flexible. So when you're finished with the operation, you can then remove everything that you put inside the incision, and then the skin will go back to its normal place. Whereas if you're in first year medical school and you go to your dissection lab and you are working on a cadaver, in other words, a dead person's skin has got not a lot of collagen at all because the person's dead. So then the collagen is broken down. So what you have to do if you want to look at what's inside, you actually have to make a much larger incision, okay, because you can't really stretch this anymore, okay? So my main point of saying all of this is that collagen is essentially the reason why things are stretchy in our body and things are tight, and it's also something that holds structures together. So if you look here, this is your collagen right here, okay? Your dermis is full of collagen, okay, and it's sticking the top layer of your skin to the bottom layers here, okay? And what happens is that as you age, the collagen, it reduces, okay? It breaks down. Collagen is like proteins, okay? As you age, these proteins get broken down, and so that's what causes wrinkles, okay? Because your collagen, when you're young, it holds your skin very tightly. But as you age, what happens is that your collagen kind of becomes less, and so your dermis it's not as tight. So the epidermis, which is the skin that you can see from the surface, it's not stretched out anymore. It's kind of like very loose and flexible. Just loose, I mean. So it creates these wrinkles. Okay. So that's why as you age, it becomes very wrinkly. Okay, so let's look at this clinical point right here. Okay, so this is quite an interesting clinical point that you can remember, and you can actually probably impress your professor, or even if you go to the hospital and you're speaking with a surgeon, maybe the surgeon will ask you, well, if I'm operating on, let's say, the arm, if I'm operating in this region of the arm, okay, why is it that I make an incision if I want to access the muscle, for example, that's beneath it, or the artery, the brachial artery, if I want to access the brachial artery, why is it that I make an incision in this direction and not this direction? So you can answer, basically, it's so that you make incisions according to the tension line. So on your body, okay, these are the tension lines that exist. And what do I mean by tension lines? So essentially your dermis, okay, it contains lots of collagen, and the collagen often in certain areas of your body, they are arranged in a certain direction. Okay, so let's say here, if we zoom in here, okay, to your arm, most of the collagen in your dermis it's arranged in this direction, downwards. Okay, so it makes sense that when you want to make an incision, when you want to cut your skin, you will cut in the same direction as the collagen, so that when you want to suture the skin after your operation, it's easy for your skin to heal itself. Okay, if you made an incision this way, after you suture, after your operation and you do your suturing, it's really difficult for your skin to regenerate because you've cut through so many different collagen fibers. Whereas if you cut through in the same direction as the tension lines, then it would have been easier for your collagen to heal. So in the same sense, what I'm trying to say is that in your arm, the collagen in your dermis is traveling in this direction. Along your neck, it's traveling like this and like this. On your abdomen, it's traveling in this direction and this direction. So, and on your legs, it's traveling in the directions that you can see on the screen, and on your face, it's traveling almost horizontally. Okay, so these lines here, they're called tension lines, and a tension line is essentially the direction that your collagen is arranged in, is traveling in your dermis. Traveling might be a bit of a misleading word because your collagen doesn't move, but what I'm trying to say is that the direction that they're arranged in. Okay, so you can try and remember that point, and you could probably impress a professional. Okay, so now we've talked about the epidermis and we talked about the dermis. We said that the epidermis, what's its function? Right, so its function is essentially just a waterproof layer, protective layer for the body. And what about the dermis? What's the main function of the dermis? What is it? Right, so the dermis essentially, it's just a collagen layer. Okay, so now let's look at what are the other things that are in the skin, because remember we went back Okay, here we said that there's so many different functions of the body, like protection, thermoregulation, contains the body, there's sensation, vitamin D, beauty. So there's a lot of functions of the skin, and that means that there's probably some other things, some other structures that are like embedded in the skin, and those are the appendages. So those are like your hair follicles, okay, as you can see here. And your hair follicles, they're associated with they're associated with this muscle called your erector muscle. So let me try and find the erector muscle here. It's not too obvious here. Let me go back to the other picture. Right, so this is your hair follicle. This is your hair, and then this is your hair follicle, and it's associated it's associated with this muscle here. This is called your erector muscle. So if you've ever noticed that when you're kind of cold, your hairs point up on your skin, and this is because that muscle, it contracts and it forces your hairs to point upwards. Okay, remember that the function of that was it was to regulate your temperature, so that when you're cold you can trap some warm air beneath your skin, above your skin, so that you can kind of create a warm barrier. Okay, so your hair follicles are associated with those muscles, and they're also associated with your sebaceous glands. So let me go back and I'll show you what these sebaceous glands are. I did kind of mention it before. So your sebaceous glands are here, and what happens is that they pump oily material into your hair follicle, and it rises and it covers the skin. And so its function essentially is to create a moisture to the skin, and in that moisture there's also acidity, so it protects against bacteria. So that's something that you should remember about your hair follicles. It's associated with sebaceous glands. So while we're on the topic, if you've ever heard, or maybe you know someone that has acne, acne is essentially, it's a skin condition which often affects young males. And what it is that you have a blockage of your sebaceous gland. So when your sebaceous gland is blocked, you've got all of that oil that's kind of compacting. It's kind of collecting in the gland, and it's not being let out. So all of the oil is kind of collected, and then what happens is that it gets infected. And when it gets infected, that's when you get something known as the whiteheads or the blackheads. And that's essentially what acne is. So if you look here, okay, this patient has so many of these blackheads or whiteheads, and it's because their sebaceous gland is blocked and it's infected. Okay, and another thing that's inside your skin is your sweat glands. Remember, we talked about your sweat glands. They're important for your thermal regulation. Also, there are small arteries in the deep dermis. There's veins as well, of course, and there's also lymphatic vessels as well. So you can see here there's red arteries, and there's veins, and there's also nerves for your sensation. Okay, so as a recap, all of these structures, they aid the skin, and they aid the skin for its functions, which we listed before. And that's really the function of your integumentary system. The same function as your skin, basically. Okay, so what's under the dermis? So remember we said that another one of the appendages, the supporting structures of your skin, is your subcutaneous layer. Okay, we said that the dermis, or underneath the dermis, okay, so this is your dermis here, this is your dermis, this is your epidermis. Underneath the dermis, you have what we call your subcutaneous layer. And essentially, the good thing about medicine is that oftentimes things do make sense. Sub means below, and cutaneous means skin. Okay, here look, cutaneous means skin. So underneath the skin, you have a subcutaneous tissue layer. So what is this tissue layer? So the subcutaneous tissue, it's located between the dermis and the deep fascia. So the deep fascia essentially is like a tough layer that covers your muscles. Okay, so what it is that you've got your skin, and then underneath your skin you've got your subcutaneous layer, and then underneath that you've got your muscles. Okay, but the layer that covers your muscles is known as the deep fascia. It's kind of wrapping for the muscle so that it stays tight. So the subcutaneous tissue is located between the dermis and the deep fascia that's covering the muscles. Okay, so if you look back here, it looks like fatty, spongy material. So what it is loose connective tissue. Okay, and most important is that it stores fat. So why is it loose connective tissue? Because essentially it's there to connect two things together. Remember we said one of the functions of collagen is to connect things. Well, the subcutaneous tissue, it's connecting the skin to the muscles, basically. Okay, but another really important function of the subcutaneous tissue is to store fat. So in this layer of the body, this is where we store our fat. And the interesting thing is that in males and females, the arrangement of this fat, it varies. It's not the same. So males tend to have their fat located in different places to females. So an easier way of explaining it would be that females tend to have more fat around their waist and legs, I presume. Okay, so the subcutaneous tissue, the subcutaneous layer in around a woman's waist will be thicker than of a man's. Okay, maybe a man's subcutaneous tissue is greater around the belly and maybe the upper body. And also you can kind of imagine, if I tell you that the subcutaneous tissue is the place where we store fat in our body, which person will have a thicker subcutaneous layer? A thin person or a obese person? Right, the obese person, obviously. Okay, so without kind of speaking too much about that, that's essentially the subcutaneous tissue. It's to connect the muscles to the skin, and it's a fat storage. It also has some sweat glands that run through it, and it has blood vessels and nerves in it as well. But the main thing to take out of this is this first point here. Okay, so we're almost actually finished with the content. We've only got this slide left, and then we're going to start talking about clinical correlates. So, and this is also quite an interesting part. It's not too hard to remember. So, there's another part of the integumentary system that's important for the structure, and it's called skin ligaments. So when I first studied this, I thought to myself, ligaments? Skins have ligaments? That's so strange. I thought it was only bones that had ligaments. But skin does have ligaments, and their function is basically to tighten the skin, okay, to hold it in place. So what it does is that between the deep fascia, remember the muscle is covered by deep fascia, and the dermis, okay, there's ligaments that run through like this. If you can see here, so the white thing here is your deep fascia, and this layer here is your skin, of course, and the yellow thing is your subcutaneous layer, and it's almost like ropes or strings holding it together. And so it runs through. So if this is your deep fascia here, and then above that is your subcutaneous tissue, and then your dermis is here, and then your epidermis here, what happens is that these ligaments, they run through, these ligaments, they run through your subcutaneous to your dermis, okay, like this. It should be like this, to like tighten it, to pull it closer to the muscle. And so the more ligaments that you have in an area of your skin, the tighter the skin will be to your muscle, the less flexible, like this. So if you look here in this diagram, and you can even try it on yourself, on the back of your hand you can pinch your skin and lift it off. That's because there's not a lot of skin ligaments holding your skin down to your muscles, okay? Whereas if you look on your palm, okay, and try and pinch your skin, you're not going to be very successful. It's so hard to pinch your skin and bring it upwards. Even if you look on the top of your feet and try and pinch your skin, you can lift your skin up. But if you look at your sole, if you try and pinch your sole, the skin is much tighter, and that's because there's more skin ligaments. So that's the function of these ligaments, okay? Right. Okay, so that's it with the integumentary system. That was an introduction to the integumentary system. There's not much more that you can really say about it. So what we're going to do now is that you can pause the video, take a break, try and review things. What we're going to do now is I'm going to give you some clinical correlates, some interesting points. The examples I'm going to give you, you don't need to memorize them. Just try and like soak it in, try and enjoy it. It's try and relate the points that we studied just now, and try and like it's always nice to have some clinical examples rather than just memorizing facts and these things, because at the end of the day, this is why we're studying anatomy, because we want to relate it to the real world. Okay, so now that you have taken your break and you're fresh and you're ready, let's move on. Okay, so the first clinical example I'm going to give you is that what we've studied, your skin, essentially, it's really important when it comes to your physical diagnosis, for example. So later on in medicine, you're going to come across a subject called physical diagnosis. And in this subject, basically you're going to be doing a lot of observational things. Like you're going to be looking at the person's facial expressions, the person's mood. You're going to be looking at the patient's you're going to be inspecting the patient's skin. You're going to be inspecting the patient's if the patient has any abnormal structures or lumps or things like that. And you're going to be doing a lot of palpitation, and basically you're trying to grab a lot of clues from the body, from your observation of the patient, to maybe point you in the correct direction of a possible diagnosis. And so one of the observations that you're going to be doing in physical diagnosis is looking at the patient's skin, because a patient's skin can actually tell you so much about a possible condition that the patient's suffering from. So for example, cyanosis is a bluish discoloration of the skin, and it's an immediate indication to the doctor that there's actually less oxygen in the blood. Okay, so this could be for several reasons. It could be possibly for a cardiac reason, where there's more deoxygenated blood in the body than there is oxygenated blood. And you can see here, like if you're in the pediatric ward and you come across a baby and the baby has bluish of the skin, then you would immediately think of a cardiac condition, and you would go and you'd do an echo, for example. Okay, so the reason why the baby has bluish discoloration around the lips and possibly the fingers or the nose tips or the ear or the lips is because the skin is a lot thinner in those areas. And so the blood vessels, like you can see here, right, so the blood vessels here that are running through the dermis, they're much closer to the surface than, let's say, your arms or your abdomen or your legs. Another thing is something called jaundice. Okay, remember, just enjoy this. You don't necessarily have to memorize these things. So jaundice is essentially an orange discoloration of the skin, and jaundice, if you see an orange discoloration of the skin, immediately you're going to think there's something wrong with the liver, because there's an increase of something called bile. Okay, the liver is supposed to break down bile, and it's supposed to get rid of it through your bowels or through your urine. But if it builds up and it goes back into your blood, then what can happen is that you can get this orange discoloration of your skin. So in physical diagnosis, looking at your skin can be really important, because lots of different changes can occur and each one can indicate a possible diagnosis. Right, okay, so the next thing is inflammation. So the skin is really important when it comes to inflammation, because what can happen in inflammation, which is essentially when your skin gets infected, or maybe there's an allergic reaction, or there's I should have said here, repeat this twice, allergic reaction, or if it's infected, is that the blood vessels, they're going to get very dilated here, and lots of oxygenated blood is going to run through the blood vessels. And so the reason essentially why you get inflammation is that there may be an infection, or there may be some kind of problem in that certain area of the skin. So your blood wants to your blood vessels want to dilate, so that all of those maybe immune cells or things that can help solve the problem can rush through to that area and get rid of the infection. So what happens in turn is that you get lots of blood collecting in that area, and because oxygenated blood is red, the whole of your skin becomes very, very bright pink or red. And essentially that is inflammation. Okay, so as I said here, blood vessels dilate in the area, lots of blood flow goes through, and it makes the skin go red. And because blood is hot, the area of your skin will also be hot there as well. Okay, so incisions, remember, this is the third clinical correlate for your skin. Remember we said that these lines here, they're called something. Do you remember what they're called? Tension lines, exactly. So your tension lines, remember, what were your tension lines? Do you remember what your tension lines were? Right, so your tension lines are essentially the pattern that your collagen is, or the direction that your collagen is traveling in your dermis. Because remember, your dermis is just collagen basically. And so in your body, okay, different parts of your body, there's different directions of your tension lines, okay? So when it comes to making an incision, maybe when you're about to operate on someone, it's really important that you make your incision, or try to make your incision, in the same direction as the tension lines. Because what can happen is that if you make an incision in the opposite, in a different direction, then you're going to be damaging more collagen fibers, and it's going to make it very hard for your body to heal that specific cut. And so what I mean is for example here, this surgeon has decided to make an incision in the same direction as the tension lines, okay? So when he did the suturing, it was really easy for the body to heal, and even the scar will be a lot less obvious, and the healing will be much quicker as well. Whereas this surgeon, he decided, maybe he made a mistake, or maybe he was forced to, because the only way was to make an incision in this direction, but he made it in a perpendicular direction to the tension lines. And so what happens is that this surgeon number one, he cut through only a few collagens in this direction, whereas this surgeon, he cut through so many collagens, okay? He cut through all of these collagens. So when the scar here, or when the incision is healing, it has to heal all of these cut collagen fibers, and so the scar will be a lot bigger, and it will take a lot longer for your scar to form. Okay, and if you're interested, I'm not going to talk about it for too long, but doing this can actually be one of the causes of something called a keloid. And a keloid is this kind of a hyper overgrowth of your scar. So you make an incision, and then it's supposed to just heal a little bit. A normal scar is supposed to form, but instead what happens is that too much collagen is put in that scar area, and too much healing has happened that you get a massive lump. Let me try and actually show you what a keloid is. Hang on. Okay, let me try and show you what a keloid is. Just so you get a good idea. it's more beneficial. Okay, so this is a keloid. Okay, so this was supposed to be a normal scar. Okay, it was supposed to be a normal scar, but because maybe one of the reasons is that the incision was made in an opposite direction to the tension lines, so there was too much healing, and so this bump was formed, and this is essentially all collagen. Okay, here you've got another keloid, more keloids. So this cutting in the wrong direction to the tension line is not the only reason for a keloid to form. There are other ones like genetics, or they're more common in African Americans, but that is essentially what a keloid is. Okay. Right. Okay, so stretch marks. So this is another thing that's related to the skin. So remember that the skin, okay, has something in it that allows it to be stretchy. So what do you think it is? Right, so the answer is right here, collagen. Okay, and where is collagen located? Right, the dermis, exactly. So the collagen is responsible essentially for the stretchiness of the skin. But what happens, so when someone wants to, let's say when someone puts on weight, and they put on weight in a slow fashion, then the collagen can kind of increase, and it can accommodate, and it can stretch slowly with the person's obesity. So as the person increases weight, the collagen in the dermis will also increase to kind of stretch. Okay, but what happens is that if someone puts on too much weight too quickly, the collagen in the dermis can kind of get broken down, and it can overstretch, and then that's what creates the stretch marks. Okay, because these stretch marks, they're not supposed to be there, because essentially the collagen was supposed to, there was supposed to be enough collagen for the skin to just expand normally. But these stretch marks are basically broken down collagen. It's not, the collagen wasn't strong enough to accommodate for that increase in size. So that's why in pregnancy, for example, a lot of women, or some women, do get stretch marks because their collagen in that area of their body was not strong enough or abundant enough to accommodate that stretch in their abdomen. Also, as I said, rapid obesity is also another cause. There is a pathophysiologic condition called Cushing's syndrome, which actually causes stretch marks on the abdomen and around the body. But it's not necessarily because of obesity, but it's because in Cushing's syndrome, okay, remember, you don't need to know this right now. I'm just telling you so you can get a little bit, so I can arouse your curiosity for physiology and pathology. But in Cushing's syndrome, you have an increase in a hormone called cortisol. Okay, and the function of cortisol basically is to amp up your body's kind of energy production. So one of some of the things that your cortisol does, for example, is that it will break down the fat that's in your body because it wants to get energy. It will break down your glycogen stores, okay, because it wants energy. But then another source of energy is protein, and so because collagen is made up of protein, your cortisol will go to your collagen in your dermis, and it will be like, hey, I'm sorry, but I gotta break you down because I need energy. So it will break down the collagen in your dermis and that will result in stretch marks because your skin will become less stretchy, so you'll get stretch marks essentially. So the take-home point from this slide here is not necessarily to remember everything, but just remember that stretch marks are because you're breaking down your collagen. Okay, it's damaged collagen. That's what results in stretch marks. Right, next one. Okay, so I hope you're enjoying this. I find these things really interesting. It's like I love like clinic orientating what I just learned to clinical stuff, because I hate just memorizing things. It's really interesting to relate things to real world situations, because at the end of the day we're going to be doctors, so it's good to make it relative. Right, so lacerations. Okay, so a laceration is basically a cut into the skin. So this could be this often is it could be an accident, or it could be a trauma patient where someone got stabbed, for example. So the thing that you need to understand about this is essentially a laceration can be superficial or it can be deep. So now that we actually brought up these words, do you remember the difference between superficial and deep? We did study this in the last video. So if I draw a picture here, if I draw a diagram here, and let's say that this is your skin, okay? So which is the superficial layer and which is the deep layer? Okay, I feel like maybe I'm being slightly patronizing. So this is superior and this is deep. So remember, just for someone who just didn't remember, superficial means up and deep means down. Okay, as in, sorry, superficial means like up as in higher, okay, closer to the surface, and deep means further away from the surface. So when you see a laceration that has only penetrated the epidermis, you don't need to suture that. And the reason is because, or can you kind of guess what the reason is? You can kind of pause the video and let me know. So the reason is that when you cut through the epidermis, there's no blood vessels in the epidermis. There's not going to be a lot of bleeding. So you don't, and the epidermis, remember, it has a lot of cells in the basal area, at the bottom, that are going to regenerate very quickly. So you can just put a plaster on it and leave it. Okay, there might be a little bit of bleeding, but if you see that it hasn't gone deep, then you can just leave it. Okay, but if the laceration is deep, so it's actually got very deep. I think I have a picture here. No, I don't. Okay, if the laceration has actually got very deep and it's penetrated the dermis, you're going to get a lot of bleeding. And the reason for that is because you have penetrated, you have cut through the vessels that are in your dermis, and that's causing the bleeding. And for that, you do need sutures. Okay, so the last one is your burns. So I'm not going to go over this in a lot of detail because this can be for another time completely, because this can get a little bit complicated. It's not too complicated, but it just takes time to explain. But essentially, burns can be chemical burns. Okay, so you can have, like in the UK, for example, recently there's been a lot of cases of acid burns, acid attacks. So your skin can be damaged through chemical burns. It can be thermal, so fire. It can be UV, or it can be from ionizing radiation. So burns are essentially split into 4 categories, okay, depending on how much of the skin's layers have been damaged. So the first is that there's simply inflammation. There's no damage, it's just it's been irritated by some kind of chemical or thermal or UV or radiation. So it's just inflammation. There's just redness. In the second degree, you have it's slightly more severe, swelling in the epidermis. And then the third degree is where your dermis has been affected. So this is where your dermis starts. Okay, so this part has been affected. And then your fourth degree is when it's very severe and it's gone down to your subcutaneous tissue. Okay, so you can take a break if you need to. What we're going to do now is just review what we've been talking about, just so you take away the main points of this lecture, and we kind of just like wrap up everything quite neatly. So this is the first question, okay? So what I'm going to do is I'm going to ask the question. You can pause the video, try and answer it, and then I'm going to quickly explain the answer. So what are the main parts of the integumentary system? You can pause the video and try and answer. Okay, so the main parts of the integumentary system are your skin, your appendages, and tissue. Question number 2, what are the two parts of the skin? So the two parts of the skin are your epidermis and your dermis. Question number 3, what is the main function of the skin? So the main function of the skin is protection, thermostasis, holds body in place, vitamin D production, sensation, and beauty. So you can go back and kind of try and explain these a little bit more to yourself so they make sense. Number 4, what is the, oh sorry, I kind of did that quite quickly. What is the epidermis basically? Like what is the epidermis? Like what's its function? And it is essentially keratinized, waterproof protective layer, and it has no vessels. Okay, so what is the dermis? Dermis is essentially a connective tissue layer. It contains appendages such as those hair follicles, your sebaceous gland, your sweat glands, your blood vessels, and your nerves. Number 6, where is the subcutaneous tissue located and what's its job? So the subcutaneous tissue, it's located in between the deep fascia and the dermis. Okay? It's basically just connecting your muscles to your skin, and mainly its function is to store body fat. And finally, what are skin ligaments? These are ligaments that connect the dermis to the deep fascia, and it's what makes the skin tight or loose. Remember, you have more skin ligaments on which side? The upper part of your hand or the palmar side of your hand? Right, more skin ligaments on the palmar side of your hand. Perfect. Okay, so what do you do now? We've finished that part of the chapter. What do you do now? So the main thing to do is to make sure that you review the main points of the class. So these are the main points. So make sure you understand them and you're able to teach it to someone. So you don't have to go and teach it to someone. It'd be amazing if you could do that, because then it would burn into your brain. But try and learn it in a way where you're comfortable enough to teach it to someone that doesn't know anything about the subject. Try and understand the clinical correlates that I was talking about. So like the lacerations and the burns and the inflammation and all of those kind of things. Try to understand them. You don't necessarily need to memorize them, because you're definitely going to be studying them in more detail in other parts of medicine. But just be aware of it, because at least it helps you understand why studying what we just studied today is important. Okay, and once you feel like you've mastered the main points, move on. Okay, the main points these points here, they're the most important part. Once you've understood those pieces of information, just move on with confidence onto the next chapter, and I will see you then. So good luck, and I hope you enjoyed the video and found it useful. If you did, please subscribe and like. I would really appreciate that. The more subscribers I have and the more likes I get would definitely motivate me to make more videos. I hope to make a lot more videos of anatomy and possibly even the rest of the basic sciences in medicine. And thanks a lot, and I'll see you in the next video. Bye.